Morning. Morning, Sensei, Dr. Jason, and all of the participants.
Morning.
Hey, how are you? I'm sorry, we have a trouble in the Zoom meeting, so you delay to join this group. Sensei, can you talk
Yes.
now, Dr. Jason, or are you still waiting for the other participant?
No, we TMU are all attending already logged in.
Okay, we can start.
Yeah.
Oke, Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. We are in the fourth meeting. Very happy to see you. Hopefully you in the good condition and stay healthy and safe. In this time, we have a fourth virtual meeting about elderly people. Let me to share about our agenda today. Okay. We have a virtual presentation on Friday, 24th September 2021. In this topic, we will discuss about the understanding impact of COVID-19 in elderly people in the Philippines, Indonesia, and Japan. The presentation and question and answers about 30 minutes for 3 groups. And then the participants should go to the breakout room and they have the group work for 20 minutes and summary and report for the group work around 15 minutes. Then we have the 3 presenters today. This is the presenter. The first presenter, it could be for Faith College University, and the second presenter from Tokyo Medical University, and the third from School of Nursing from UMY. If you're ready, please, from Faith College University to present about the effect COVID-19 on elderly people. Please, the time is yours.
Good morning, everyone. So for Faith Colleges, so Zen will be the one to present. Then go ahead.
Hello, good morning. Can you see my slide already?
Yes.
Okay, thank you. So good morning, everyone. I am Zairenad Manay from Faith Colleges, and today I will be discussing about the understanding effects of COVID-19 to older adult in the Philippines. So these are the topics that I am going to discuss. First, I will discuss who are the senior citizens in the Philippines. Then second is the impacts of the COVID-19 on older adults. And lastly, the benefits and programs that are given by the Philippine government to protect the older adults. So according to the Philippine Republic Act 9994, senior citizens are the Filipinos living in the Philippines who are 60 years old and above. According to the 2015 Census of Population, there are 7,548,769 senior citizens, which is 7.5% of the total population in 2015. So in terms of population according to sex, 4.22 million are males and 3.33 million are females. So as you can see in the graph, the number of senior citizens are increasing. It started from 4.57 million in 2000, and in 2015, it is 7.55 million. As of 2020, there are 8.2 million senior citizens, and it was said to exceed 10 million, which is equivalent to 9.7% of the total population in the Philippines in 2021. So this is just a quick trivia. So the person in the picture is Francisca Montes Susano, and she is the oldest Filipino living. She just turned 124 years old last September 11. So moving on, we all know that senior citizens or the older adults are the most risk of deaths due to COVID-19. So here are the cases by demographic. So as we can see through the graph, we know that it is really detrimental to older adults. COVID-19 is really detrimental for older adults in the Philippines. There are less cases, but unfortunately, there are also less recoveries, leading to increased incidence of death. So these are the effects of COVID-19 on older Filipino adults. So first is economic insecurity heightens their vulnerabilities in terms of inability to access healthcare and pay for healthcare bills. This is because poverty in the Philippines worsened during the COVID-19 pandemic due to the lockdowns and other restrictions made by the government. Then second is depression and anxiety. So since they are at high risk for the COVID-19 virus, they are housebound and only allowed to go out when it is extremely necessary in terms of health emergencies. They experience loneliness, pessimism, deteriorations in cognition, and disruption in sleeping patterns due to prolonged confinement and mandated isolation. Then the third is unmet spiritual needs. Most older adults in the Philippines are very religious. However, due to lockdowns, they cannot go to churches to meet their spiritual needs. Then poor social well-being due to the lockdowns, they are not allowed to go out of their homes. And also, decline physical well-being mostly is due to stress and, of course, COVID-19. Then lastly is dying alone. Patients with COVID-19 who are hospitalized are completely isolated in ward and are separated from their loved ones as no visitors are allowed in the hospitals. So once they die, they are immediately cremated. Then we ask some older adults about their experiences throughout this pandemic, and here are some of their answers. So when we asked them, how did you feel when the COVID-19 pandemic in the Philippines and lockdowns are implemented, and why? So one answer is, initially, I thought we'll get through it since we always try to follow the health protocols. But since we don't wear masks at home, when one of us got infected, it easily spread within our household. It was devastating. Also, I feel stressed because my illness got worse since I have limited time and opportunity to go to the hospital and monitor my disease. I also experienced financial difficulties because hospital rates increased due to pandemic. Then it is sad. Most of the things we used to do have certain restrictions now. Then do you still do the same daily routine as you did before the pandemic? If no, what are the changes and why did it change? So one said, no, they are already working online. Gardening is limited and no more dine-in. Outside, everything done outside is with restrictions like face mask and face shield. And the other answers are no as well. Unlike before, it is now difficult to have access to my doctors. And as they tried not to go out unless it is urgent to limit the chances of getting the infection or the virus. Then how will you describe yourself before the pandemic? Before the pandemic, I can go out easily for my health checkups. Then I have more time going to groceries to buy my family's needs. Then they also said that they are energetic, workaholic, and full of energy. And others said I'm not that active, although I always prefer to walk, especially if the destination is not that far. But I don't usually exercise even at home. Then how do you feel now that it has been a year since the pandemic started in the Philippines? So they said that they are hopeful that the pandemic will end, praying that the infected people will lessen, and they are grateful for every morning that they are still alive. Then also, they feel sad since initially we thought that somehow everything will go back to normal once they started the vaccination program. But since we still can be infected after being vaccinated, it will take little more longer before everything will be back to normal. So these are the benefits and programs for the senior citizens. And in the Philippines, they are issued an ID and a booklet that they need to show to avail most of the benefits entailed to them. So the first one is the vaccination, or we call it as the res vacuna. Then they also give financial assistance, so in social pension, or this is the monthly allowance given by the government. Then the ayuda, so it is given in goods. So it is like a donation from the LGUs or the local government units and the community officials, or sometimes the non-government organizations also give them to other Filipinos or senior citizens who are in need. Then 20% senior citizen discount. So this includes discounts in restaurants, for transportation, and for other medications. So this is being implemented even before the pandemic. But for the restaurants and transportations, it usually varies from the owner or the restaurants itself. Then lastly is the free medication and checkups in rural health unit and health centers. So vaccination among senior citizens is the second priority of the Philippine government. And as of September 22, the fully vaccinated senior citizens are 4,316,470. So the senior citizens with comorbidities or with diseases, they just need to go visit their physicians, then ask for medical certificates or proof that they are allowed to have the vaccination. So that is all for my presentation. Arigato gozaimasu. Salamat pagi and maraming salamat.
Thank you, Zirenal. Okay, from Faith College University. I think this is a very nice presentation, and I very interesting about your study. I think this is a qualitative study, and you ask the senior deeply. Yes, it's very nice data, I think. Yeah. For the others, do you have any question for the Faith University? If you have any question, you can raise hand. Hello, this is any question for Faith University? Okay. I will ask you, Serena, or the others. In your presentation, you say about the senior should pay for healthcare bills?
Again,
Uh,
can you repeat the question?
in your presentation, you said that the senior should pay for healthcare bills. Is it there is no insurance or what's like in Philippines?
There is the PhilHealth insurance.
Mm,
The paying of bills, it will depend for here in the Philippines, we have the public and the private hospitals. So
oh,
in
I see.
public, there are no fees and
Mm,
in health centers, but in private, they are fees.
okay.
The public hospitals are sometimes lacking of instruments and equipments. That's why they are still paying fees
Mm,
for.
yes, I think the same problem in Indonesia. A half they have to pay, should pay, but sometimes they have a free,
Yes.
depend on the condition. Okay. The others you can you have any question or Dr. Jason?
Dr.
Uh,
Nervita,
yes.
this is just in addition. Okay, so like what Sen has mentioned, so we have here universal healthcare through Philippine Health Insurance, but it does not cover everything. So
Oh
there
yes.
is
Okay.
a minimum or maximum amount. So
Okay. Yes.
for the disease or so that's why there will be times that aside from the Philippine Health Insurance by the government, so they have their own private insurances, health maintenance. Most of the time, out of the cash fees to finance for their
Okay. Thank you. Uh, okay. Thank you for the clarification, Dr. Jason and Mao Okabe from Tokyo Medical University. Do you have any question, please?
Thank you for your presentation. I'm Mao Okabe. I have a question. There are many elder people living alone in the Philippines.
No, mostly people in the Philippines are living together with their relatives.
Mm,
Thank
Yes.
you.
okay. Yeah. Okay. Thank you. I think this is living alone is one of the problem in the other country. Okay, thank you for the presentation for Zirenal from FAITH. And the second presenter is from Tokyo Medical University. Who will present today, please? The time is yours.
Hello everyone. Today we would like to present about the effect of COVID-19 on elderly people in Japan. Next, please. First, I would like to talk about the current situation of the elderly in Japan. Next, I will talk about the impact of corona on the elderly. Finally, I will talk about what the national and local governments are doing. Next, please. First, let's talk about the aging rate in Japan. The aging rate in Japan is the highest in the world, exceeding 28% by the year 2020. As the aging rate is expected to continue to grow rapidly in the future, Japan has a system in place to support the elderly. Next, please. The increase in the number of elderly people aged 65 and over living alone is remarkable for both men and women. 1 in 8 men aged 65 and over, and 1 in 5 women aged 65 and over live alone. This graph shows that the number of elderly people living alone is increasing. Next, please. Next, take a look at this graph. According to the Ministry of Health, Labor and Welfare, 59.7% of the elderly receiving care at home are elderly caregivers who are also 65 years old or older, the highest percentage ever. Many of the elderly require care due to dementia, and in some cases, elderly couples with dementia are caring for each other. In Japan, as a society as a whole has shifted to nuclear families, elderly couples are now living alone and facing the problem of elderly care. And the percentage is expected to increase further in the future. Next, please. Next, I would like to explain about Japan's comprehensive community care system for the elderly. The Ministry of Health, Labor and Welfare has set a target of 2025 to create a town that supports the elderly by providing housing, medical care, nursing care, prevention, and lifestyle support in an integrated manner, so that they can continue to live their own lives in their familiar communities until the end of their lives. Even if they need nursing care, it's the aim of maintaining their dignity and supporting their independent lives. We are building a town that supports the elderly. Next, please. This is followed by the number of infections and deaths among the elderly. Please see the graph on the left. The number of new positive cases among the elderly is lower than that of people in their 20s, but the number of deaths is mostly among people in their 70s or older, as shown in the graph on the right. Next, please.
Elderly people can be vaccinated preferentially over young people because they are more likely to have underlying disease or to become seriously ill if infected with COVID-19. In principle, vaccination sites are medical institutions or vaccination sites in the area where they live. Currently, September 2021, the vaccination rate for people 65 years and older is 19.09% for the first dose and 88.58% for the second dose. Next. An apartment complex in Kanagawa Prefecture is home to about 50% elderly people, and there is no public transportation or medical facilities in the area. Therefore, the prefecture government created a team of doctors and nurses to visit a housing complex where the elderly live. The medical team will visit the housing complexes to provide vaccinations. In addition, for elderly people who have difficulty making online reservation for vaccinations, volunteers, including Students and staff assisted the elderly in making vaccination reservations. Next, the elderly are more likely to become seriously ill, so their activities are restricted. The nursing care prevention and life support service projects in, conducted in each region was cancelled or postponed, and nursing care prevention activities were also severely restricted. Balancing infection prevention and nursing care prevention has become a serious issue faced by the super-aged society. The continued self-restraint caused by corona reduces the amount of physical and social activity, which leads to the development and progression of frailty, causing fails, hospitalization, and the need for nursing care. Frailty includes not only physical but also psychological and spiritual factors, as well as social factors, all of which affect the limitations of daily life. Next, I would like to talk about the response measures that the government is calling for. The two activities are physical activity and social activity, and it is important to promote these activities while seriously preventing infection in order to prevent nursing care for elderly. Specific measures to prevent frailty in the elderly include exercising to prevent muscle weakness and eating a well-balanced diet to maintain immunity and stretching muscles. Furthermore, keeping the mouth clean and preventing infections, as well as moving the muscles of the mouth by talking with friends and family, can help prevent cognitive decline, prevent loneliness, and relieve problems and anxiety. With regards to abuse of the elderly, municipalities are called upon to provide appropriate support in preventing and responding to elder abuse, while also cooperating with related parties. Next. Lastly, we will show you a video of elderly people recuperating at home due to the spread of COVID-19 in Japan.
Tingkat kesadaran ada, terus tingkat konsentrasi, gangguan penilaian, kemudian
化したものとみられています。
誰も入らなかったら多分あのままお亡くなりになってた可能性っていうのは相当高かったと思います。
女性の対応に当たった訪問看護ステーションです。感染者が急増する中、同じような依頼が相次いでいます。
結構前ですよね。82歳男性、お子さんは入院。はい。で、お父さんがお一人になってしまっている状態。はい、こんにちは。
家族に代わる介護の担い手確保は容易ではありません。女性は入院することもできず、介護ヘルパーも見つかりませんでした。県外に暮らす孫2人が駆けつけましたが、うち1人も感染。女性を介護できませんでした。
高齢者の方のやっぱり一人暮らしで症状が軽いからその自宅で療養するっていうのは少し違うのかな、難しいのかな。
結局、看護師が女性の食事や排泄などの介助も担わざるを得ませんでした。息子は回復傾向が見られ、女性もおとといようやくショートステイを利用できることになりました。看護師は対応後の検査で陰性でしたが、感染者への対応は大きな負担でした。
コロナの利用者さんをお受けするにあたって、そこも本当に苦渋の決断でしたけれども、ただ本当に命に関わる方が在宅に本当に多い。
専門家は、
介護難民化状態化している今、状況と言えますね。臨時の、施設なり簡易な施設を設けて収容できる施設の受け皿を今から、早期に作るべきだと思いますね。
As you can see, there are elderly people in Japan who are left at home, unable to be hospitalized or get support from their families. They are in mortal danger. The medical staff also have to care for them under the high possibility of infection. So, Japan needs to improve its medical system so that the elderly people can receive adequate medical care. Thank you for listening.
Thank you for the presentation. This is a very nice presentation. If you have any question, you can raise your hand and deliver to the Tokyo Medical University. The problem is very clear. The elderly people in who's living alone. This is a many big problem, I think. And the situation, the population in Japan is, I think, a little bit different with the Indonesia and Philippines, because in Japan, the population of senior is the very big population compared with the youngers. I'm right? Yes. So the problem is different, I think. Any question for the others about the Tokyo Medical University presentation? Please raise your hand. Any question? Okay, I think I have a question for Tokyo Medical University. So how nursing home right now manage the elderly people especially in COVID-19? I think in Japan, so many nursing homes, and then how they manage the elderly people, especially in the in the COVID-19.
Thank you for
Yes.
question.
Yes.
We are vaccinated for first elderly people and do not visit nursing home.
Okay, they not visit nursing home. Okay, and one question again, I'm interested in the elderly people should have many conversation. What the benefit with they have many conversation for senior? In your presentation, you explain about for increasing the quality of life, the elderly people have many conversation. What the benefit for the have many conversation? Because this is a very interesting for me, and this is the new information that the elderly people should have many conversation. How about the benefit to have many conversation? If this is a good one, we can do it in Indonesia like that.
By speaking, the muscles of the mouth are moved to prevent cognitive decline.
I'm sorry, can you repeat your answer?
Okay, and by speaking, the muscles of the mouth are moved to prevent cognitive decline.
And analyzing cognitive function.
Okay, to stimulate them for cognitive function, right? To stimulation. Okay, I understand. Thank you very much for your answer. And we will move to the last presenter from UMY. Please, from UMY, time is yours. Who will be a presenter today from UMY? Okay, from UMY, please.
Okay, thank you for the time, ma'am. Here I'll present that about understanding the effect of COVID-19 on older people in Indonesia. Next. The introduction. Indonesia has confirmed hundreds of thousands of COVID-19 cases, together with thousands of death cases. The case fatality rate of COVID-19 amongst older people in quiet height, about 15% as of 9 September 2020. The COVID-19 pandemic has several impacts on the economic, health, and social condition of older people. Next. Here, a graphic of fatality of COVID-19 on older people. And next. And here, a graphic of COVID-19 positive rate of older people. Next.
Please higher font
Oh, okay.
to
And then there's a graphic from COVID-19 positive rate of older people. Next. This fatality rate among patients with an underlying disease. Thus, chronic hypertension, and the others. And next, the effect of COVID-19 on older people in Indonesia. And first, economic condition. 1 out of 2 older people experience a decline in income during the COVID-19 pandemic because reduction of employees in every field of work. And at second, income decrease for almost half population influence for the amount and quality of food consumption. For about 42% of them, the quality of meals fell. And then more than half of the respondents older people said they have not done anything to overcome the decline in income. About 3 out of 4 respondents received at least one type of assistance during the pandemic. About 7% of the respondents were beneficiaries of the PKH or program Keluarga Harapan or Family Hope during the pandemic. About 70% of them received from the PKH during the pandemic only, whilst the rest 30% received assistance from before the pandemic. And the next slide will be presented by my friend.
I'm sorry, louder, please. Rana.
Yes. So about 12 respondents
Yeah.
who needed to receive medicine stated that they had run out of medicine because they didn't have the money to buy it. And then more than 50% stated that they maintain physical health by sunbathing, adopting an activity lifestyle at home and outside the home, and exercising outdoors. Meanwhile, more than 60% of the respondents stated that they maintain mental health by playing. Next slide, please. Okay, now we will talk about the social support of the elderly people. Only 5% respondents state that they have never communicated with their relatives, friends, and neighbors, either in person or through telecommunication. Worldwide, about 75% responded state that they kept social relations via telephone, short message service like SMS, or a social networking service like WhatsApp during the pandemic. About 60% of the respondents respond that they're participating in the community activity, and around 43% respond that contributed to their families and their communities. To comments contribution was caring for children under 5 years old, 20%, followed by donation of Simbako, 19%. A total of 8% responded state that during the pandemic they received a visit or calls made by Bosiendo, cadres, social cadres, and health workers. Next, please. So in conclusion, data from all around the world shows that elderly people are most affected by COVID-19 in terms of mortality and seriousness of symptoms. But the impact of COVID-19 on older people is not limited to direct effects of this infectious disease. The COVID-19 pandemic required the authorities to impose social restriction measurement to prevent the spread, which is called Pembatasan Social Berskala Besar, or PSBB, large-scale social restriction. It's like a lockdown. In Indonesia, a social restriction measurement can undermine the economic condition, overall well-being, social connecting of the people, particular underprivileged people. Many elderly people are categorized as such. Next. Recommendation. Economic and social support of the elderly people should be maintained and contained even after the pandemic. It is critical minimize the negative impact of the loss of income and the social restriction on the welfare of elderly people, such as decreased food quality, more limited access to healthcare facilities, and their greater social isolation. Next, please. Okay, until here, our presentation is finished. Thank you so much. This is our reference, and if there are any questions.
Okay, thank you, Rana and Wardah who present today. This is from Universitas Muhammadiyah Yogyakarta, especially Indonesia elderly people. If you have any question, you can raise your hand. Okay, from Tokyo Medical University, Mami Sukagoshi, please.
Thank you for presentation. I'm Mami Tsukagoshi. Yeah, you mentioned that the quality of your diet has decreased. How has the quality of your diet decreased? For example, I thought about how I went from eating 3 meals to 2.
Okay. Can you repeat your question, Mami Sukagoshi?
Okay.
Yeah.
Yeah. You mentioned that the quality of your diet has decreased. How has the quality of your diet decreased?
Okay. Who will answer? The question is the quality of life decrease and how to increasing the quality of life. Is it right?
Yeah.
Yeah, okay. Okay, UMY, you can answer. The question is the quality of life for elderly people decrease and how you manage it to increasing the quality of life in pandemic situation especially. Yeah. They still thinking. Please wait.
Yes. I'm Pelni. I will try to answer the question. You can hear me?
聞こえますか？
Yeah.
Yes, yes.
Yeah. How to manage or organize to increase the elderly people in the pandemic? Maybe in Indonesia there is a posyandu such as a healthcare system, but for its priority for elderly people, the name is Posyandu Lansia. Lansia, it's mean elderly people. And then Posyandu such as a healthcare system, they provide such as to monitor the blood pressure and the level of glucose and etc. And then in the pandemic, it can do with a visit to every senior home by the kader. Kader it means the apa ya?
Kader is volunteer. Kader
Yeah,
is volunteer
the
from
volunteer
the people.
from the Posyandu Lansia. They can go to visit one by one to the home senior and then check the such as blood pressure and glucose level, and then when the elderly people have the problem, it can refer to primary health care system first. Yes, such as like that. Maybe it's clearly.
Okay, Mami Sukagosi, this is clear?
Yeah.
I think I will add the information that in Indonesia we have a posyandu. Like the Pelni said before, that posyandu is pos pelayanan terpadu. In Indonesia is like a catering people, who self-care from their health. So the community, elderly community, adolescent community, and adult community, because in the same like elderly community, they have the same problem, and they help each other. If the elderly have stroke and they have a same stroke, they can help each other with communication and what will you do if you have a sign and symptom like that. In Posyandu, we have a like a volunteer. Volunteer is the people who trained by the healthcare, but they don't medical practitioner. They have just trained people who can care the people, the elderly, like that, and they gathering in the same area, in the same neighborhood, like that. Okay. Do you have any question again? Yes, mau UKP.
Thank you for the presentation. So I want to know about what is the percentage of elderly people in Indonesia?
Can you repeat again?
What is the percentage of elderly people in Indonesia?
Percentage, the population, how many elderly people? Okay. Okay, thank you for the question. Okay, my student, do you know about the population of elderly people in Indonesia? The percentage is less than young people, different with in Japan, but I'm not sure about the number.
Yes, I want to answer the percentage of elderly people in Indonesia. According the institution such as Badan Pusat Statistik, it like the institution to measure the measure people of the population in Indonesia, the elderly people is 5.95% from F4 in Indonesia. It means 16 million people elder in Indonesia, because in Indonesia there are 270 million people in
Population.
Indonesia.
Yeah. Okay,
Thank
clear.
you.
Yeah, thank you for the question. I think we in end of the presentation, Dr. Jason or Naruse Sensei, do you have any opinion or suggestion about this presentation? Okay. Okay. I think are you ready to go to the breakout room, right? And don't forget to fulfill the attendance list in the chat room. Please wait for the breakout room.
90何%だった？本当。5.9% とずいぶん若いよね。人口構造がずいぶん若い。大丈夫？
Hello.
Yes, hello.
Can we transfer Charles Pile to Dr. Naruse?
Yes. Yes.
Where do you think we can transfer Charles?
Charles. Yeah. Okay.
On what room? Is it with Mao, Sae, or Sora and Manu?
I think you can transfer to another group, not Mao's group.
It's the other one with Sora and Manu.
I think Mao can manage her English.
Do you have any problem?
We would just be transferring one of our students.
Oh, okay.
With,
No problem, I think.
With the TMU student, so that if are having problem with Charles can help.
Dr.
Still 4
Jason,
people are left.
can you, this is for breakout room, right?
Yes, yes.
From them. You can write this to the chat, and my operator will transfer to the other group. You can give a note in the chat room.
Well, maybe I'll be the one to move.
Oh, yeah. Yeah.
Yeah. And I want to discuss with you about the next session.
Oh,
next
yeah.
session. So we are going to the learning summary. Going to have a learning summary next week, right? Right. 画面の共有。これだ。Yeah. And in the next week, review of the program 30 minutes and the current condition of schools of 30 minutes each, and the introduction of activities of helping the people by student. And no, これ10 minutes だな。これ10 minutes each ね。30 minutes, yeah. あら 30 minutes anyway. So, debut of the program, and the MC will be me, myself. And first of all, we are debut of the program. I review the presentation, 3 presentations by student. Then, and discuss about problems about, on COVID. Then current condition of schools, Jason, Mr. Jason, Dr. Nurbita, and myself will report about the current condition of schools, how we attack with our issues in education. And introduction of the activities for helping the people by student. Do you have any activities in your school?
Yes. But more of webinars, not really going to the.
Do you have anything? I mean, you have.
Yes,
FAITH
yes,
has it. So can you present about it? Present it, because TMU students don't do anything this kind of activities. How long do you need for presentation?
Well, maybe 20 minutes.
20 minutes, okay.
That's maximum.
And how about Muhammadia? Dr. Nurbita?
Yes.
Do you have this kind of activities?
Introduction of activities. So the student,
yes,
presentation about their activities, right? For
yes.
helping people. Yes. My student have activity to helping the people, and they are ready to presentation.
Okay. So already you presented.
Yes. Yeah. My student ready to present.
Okay, so please, only face だね。face 20 minutes.
Yes, I think 20 minutes is enough, Sensei.
20 minutes for face. Okay. Okay, so maybe that's all. And 30 minutes too long, でしょ? 30 minutes too long. Anyway.
Clarification. Current condition of our school.
Yes, yes. Maybe you are closing, still closing, so? Still closing, but I'm very interested in your education, because you are putting the advertisement on your school homepage. We are the we are the professional on remote education, such as yeah. So I want to know the contents of your education. Yeah. So that is why. Okay. Very interesting. Because even for us, we had many problems for the remote education. Thank you. So is it okay for this content?
For current condition.
How do you give the education to the student? Education student.
For the next program, I have a friend who will presentation because he handle this condition. So
yes.
I think we will explain about the situation of our school when COVID-19 happened.
Yes.
From how we are manage the student who infected and how will we manage the skill laboratory and so on. I think we'll explain about and the method, the teaching method.
Yes, please.
Yes.
Because you know, we are very small college, and Ministry of Education encouraged to the schools from primary to high school to open in the fourth semester, but not encouraged to the university to open. They hope to remain closing in the college. So, you know, it's very controversial. Anyway, okay. So in the next time, we are going to exchange the information about this kind of things. Okay? Thank you very much.
Okay, thank you, Sensei.
Hi. Hi. I'm going to back to the classroom to the student. Thank you. で、これは。
これ、違うよ、これアンサーじゃないじゃん。送ってきてください。消えちゃったの。
Hello. You ready to presentation about your group work? In this time, I will give you the time for summary for your discussion about 15 minutes for each room, and we will begin from room 1 until room 8. And I will remind you, please for fulfill the attendance list in the chat room. And if you want to have the documentation, I share the link by YouTube, and you can see our activity anytime. The link of YouTube you can see in the chat room. Okay. Yeah. Our activity we can see by YouTube. If you want to see your activity, you can look for the link of YouTube. Okay. For the next activity, we will listen about your group work. Begin from the room 1, and who will be a presenter in this section. Please, the representative from room 1.
Yes, Miss. So I will present in Indonesia the effect of COVID-19 on older people in Indonesia. So on from economic condition, 1 out of 2 older people experience a decline in income during the COVID-19 pandemic because reduction of employees in every field of work. And then from health,
you can open your camera, or you have a problem in connection?
Yes, Miss. I have unstable connection.
Okay.
Yes. So let me continue. Okay, on health condition of older people, 1 out of 6 respondents state that their psychical health has decreased during the pandemic. And then from social support for older people, only approximately 5% of respondents state that they have never communicated with relatives, friends, and neighbors, either in person or through telecommunication. So that means, in conclusion, the data from around the world show that older people are the most affected by COVID-19 in terms of mortality and seriousness of symptoms. That's all from Indonesia, and continue from Philippines.
Okay, this is the representative from room 1, or still have any presenter from room 1?
Actually, we have one from Philippines, Miss.
Okay.
So, good morning. So, from the Philippines, we have the Philippine Republic Act 994, commonly known as the Expanded Senior Citizen Act, that defines that any Filipino citizen residing in the Philippines who is 60 years old and above is considered as senior citizens. So they are the one who are most at risk of deaths due to COVID-19. That's why vaccination among senior citizens is prioritized by our government. So there are several effects of COVID-19 in older adults, including that they are most at risk, depression, the unmet of spiritual needs, for social well-being, dying alone, and decline of physical well-being. So, however, there are programs for elderly such as the vaccination program or the Res Bakuna, the PhilHealth, which is the health insurance, financial assistance or the ayuda, the social pension from the government, and the 20% senior citizen discounts, and free medication and checkups in some rural health units or health centers here.
Okay, thank you for the summary. From another room, do you have any question for room 1? Or Naruse Sensei or Dr. Jason, do you have any opinion?
Yeah. Excuse me. You said Philippines says elderly people categorize over the 60 years. 60 years, and we Japan and Indonesia are more than 65 years old, right? And why 65? Jason, Mr. Jason.
Yes.
Okay, thank you. Thank you. It's okay.
This is the different categories. Okay.
Philippines, your age.
Okay. Enough? Yes. If enough, we can move to the room 2. Who will be to be a representative from room 2, please?
So, good morning. My name is Mara Angela Torres from Faith Colleges. So, I will be the presenter for the room 2. So, Indonesia has confirmed hundreds of thousands of COVID-19 cases. So, in our country, we have also confirmed that we have the high cases for the COVID-19. So there's many similarities within our country that our government has raised or have the program. So senior citizens and or the elder people are the priority of our government. So the numbers of elders who got vaccinated in this pandemic is high. Also in the Indonesia, they are the priority to get the vaccine. So for this pandemic, in Indonesia, they have elder home care called Panti. And every month, the healthcare professionals go to houses to have them check up. So here in the Philippines, we have healthcare centers for the senior citizens. And for the financial support, they don't have the government don't give money, but they give everyday needs like rice, foods, and also in the Philippines, we have programs that every month our local government units give everyday needs, and then also we the LGUs giving them money for the elders. Thank you.
Okay, thank you for room 2. And is this another presenter from room 2 or just you?
Just me.
Just you, okay? Okay. Any question for the other groups or from Naruse Sensei or from Dr. Jason about the summary from room 2?
Don't have any question.
Okay, please. Okay. No. Sensei, no?
Yes, I have. You said NGO provided some money to the elderly people who are not able to manage their life. What's the budget? What kind of budget money NGO gets?
Same question with me, Sensei.
Yeah, is that a donation?
Yeah, donation.
Is that
And
donation?
what for?
Mm-hmm.
Okay, you can room 2, you can answer from Sensei question.
There's a budget for the elder people. We call that pension.
Pension. Every
Pension.
pension.
And for this pandemic, every month they give them money.
Good. Yes, thank you.
お金をくれるっていうのは年金をくれるんですって。
Enough, Sensei, or do you have any addition? No?
Is it pension? Pension means public social welfare, I think. But you said NGO gives the pension to the elderly people. Is that?
I think not only room 2 can answer the question. I think Faith College can answer the Sensei question, or you can or if you have any addition.
For the social for the pension, we call it the social pension. So the TSWD, or the Department of Social Welfare, is the one giving it to the elder people.
Okay, thank you. This is for all of the elderly people, the pension.
Yes.
Oh, all of them. How the criteria that the elderly people can have a pension, can got the pension? This is any specific requirement, or all the people can access?
As long
Okay,
as
Charles.
you reach 60
Yes,
years
okay.
old. You're already
Huh?
60 years old.
Oh.
If you're already 60 years old, then you can already register yourself for being the member of senior citizen.
Oh, okay,
Then
okay, I
you
see.
have a card. It's like
Yes.
this. Like this card.
Oh, yes. So
Then
if the
you
people, okay, so if the people are already 65 years old, they can register and they automatically can get the pension. Yes.
60 years old only.
60. Oh, great. Okay, that's very interesting. Okay, thank you for the room 2, and we will move to the room 3. Please, the representative from room 3.
Good morning, everyone. I'm Claudine from Faith Colleges. So I'm going to present our discussion in room 3. So we discussed or tackled about the age of senior citizen in the 3 countries. So here in the Philippines and Indonesia, we categorize senior citizens as 60 years old and above. And in Japan, it is 65 years old and above. And then we also tackle about how they live So here in the Philippines and in Indonesia, they are the same. So they are living with their family. Unlike in Japan, so elder population or older adults are living alone at home. And then we also tackle about how elder people get vaccinated. So here in the Philippines and Indonesia, so elders or older adults can't go outside since they are very vulnerable to the disease, which is the COVID-19 pandemic. And then here in Philippines and Indonesia, also older adults have a priority to get COVID-19 vaccine. And a vaccine for elderly were scheduled online. And in Japan, so they do home visit to provide the vaccination to the senior citizens. That's all. Thank you.
Okay, thank you. From room 3, another presentation from room 3, or enough for the presentation? Yes, enough, I think. Room 3, the other participant, you can. Do you have any questions from for room 3? But the summary for room 3, from room 3. I think every room have something interesting. Yes. Any question for room 3? If you not, we will move to room 4. And if you have any, okay, Sensei, please.
Yes, in Indonesia, Philippines, Japan, we are all able to take appointment, have appointment on vaccination on online. But the problem in Japan is many elderly people are not familiar to the online system. But how about the Philippines and Indonesia? Who would help? Who would help the elderly people who are not able to use the smartphone or computer?
Okay, thank you for Sensei. The question is, in Japan, the elderly people not familiar with the online system. And how about in Indonesia? How can the elderly people in Indonesia can handle with online system? Okay, who will ask? Who will answer the question? Okay, who will answer the question, especially for Indonesia? Halo, Dina, Hasti, Pelni, bagaimana orang Indonesia, terutama yang elderly people, bisa masuk ke online system? Oke. Siapa yang mau jawab nih? Senja, Pelni, Dina, Maulida, you can answer?
Yes,
Okay, Pelni.
I want
Okay,
to try
Pelni.
the answer how to elder people come into the online system. I think it's the elder people come into online system is hard because maybe they have the like information about internet or others, and then maybe when the health, especially about healthcare system, the elderly people always is helped by the healthcare system or the administration of the healthcare system, to such as to registration, the registration about the services or such as vaccination. But in Indonesia, in the first or the early time for elderly people got the vaccination is not need to registration online, because just the elder people come to the health primary care system, and then she can they can register by the administration by in the healthcare system. Because yes, the elder people, it's hard to understand the technology or the internet system in this time. Yes, maybe is it clearly?
Yes, clear. Okay, thank you. And I will add my opinion. And almost of elderly people in Indonesia still stay with their family, still stay with their child. So their child will help the elderly people. Okay, I think enough. Thank you for the question and answer. And now we move to the room 4. Who will be present in the room 4? Please, time is yours.
Good morning. My name is Princess May. I'm Faith Colleges. So for the room 4, this is what we have discussed. So the effects of COVID-19 on older adults first is in the Philippines. So again, there is our vaccination program called the Res Vacuna. So the type of vaccines that are being catered depends on the vaccination sites. But mostly the available vaccines are Pfizer, AstraZeneca, Sinovac, and Moderna. And then the vaccination among senior citizens is prioritized by the government. So they are the second in line after the healthcare workers. And as of September 22, fully vaccinated senior citizens are 4,316,470. And then we also have the Philippine Health Insurance Corporation, or the PhilHealth, and the financial assistance, as they have said earlier, or the social pension. So the monthly allowance are given by the government. And also for older adults, there are free medications and checkups in rural health units or health centers. And then for the effects of the virus, so there has been a decline in physical well-being, and some of the older adults are dying alone. And then for Japan, the population of older adults ages 65 and above is the highest in the world, as they have said earlier in their statistics. And then also, the elderly are given priority over the young for vaccination. And the vaccinations are given at medical institutions and vaccination sites in the area where they live. And unlike in the Philippines, the older adults are with their families. So in Japan, nurses are the ones who take care of elderly people instead of the families. And according to the statistics as showed earlier, the highest number of positive cases by the age is in the 20s. While on the other hand, the highest number of the deaths by age is in the 80s. And the effects of the virus on the elderly, same in the Philippines, there is also a decrease in physical activity. So, and then a decline in social activity, decreased physical and mental vitality, decline in cognitive function, and increase in abuse by caregivers. So next is the Indonesia. So for the Indonesia, there has been a frail impact on the economic and the health and social condition. So for their government have a program to elderly people it is called for the Family Hope program from the government. So the elderly people get benefit from the government. And then for the health condition, there is also an impact because they have uh, they have some difficulties to access the services to consult their health condition. And then for social support, some of the people, they have their families, relative, and friends. And then for others, they keep their social relations via telephone, SMS, or social networking services. And then older people, again, were the mostly affected by COVID-19, such as in mortality and the severity of symptoms. And then lastly, just like the Philippines and Japan, elderly people are priority to get the vaccination. So then the first in line is healthcare workers and then the elderly people. And the type of vaccines in Indonesia available for elderly people is AstraZeneca and Sinovac. That would be all. Thank you.
Yeah, thank you. From room 4, any question for other participants to room 4? Hello, any question? Or they present about the same case? No question? Okay. Okay. If you don't have the question, thank you for room 4. And we move to the room 5. Okay, room 5, please.
Okay, thank you for the time. So here we are discuss about the similarities between both countries Philippines. So there are a lot of similarity between Indonesia and the Philippines. So in the both country, even there are some elderly people who live alone, but there is a lot of them who is still living with their child, even their child already built their own family, but they, they think that they need to taking care of their parents, so their child taking the parents with to live with them together. So it means that there are still people who taking care of the elderly. And then for the next one is same in Indonesia and in Philippines that the elderly people being prioritized to get the vaccine. So in Indonesia, they got the Sinovac vaccine because there is less side effect. And then in Philippines, it depends on the area they are living. Some of them get the AstraZeneca and Johnson Johnson. And then the last one is even the elderly people being prioritized to get the vaccine, but still some of them didn't get the vaccine until now because they are afraid of the side effect for getting the vaccine, and also some of them didn't believe uh, the COVID-19, so that's why they didn't take the vaccine. So that's room 5. Thank you.
Okay, thank you from room 5. Any question from for room 5? No? No question? Okay, I think we have the same problem or the same summary. Okay. Okay, we can move the room 6. Okay, room 6, please.
Hi.
Okay.
Hi, I'm Rodora Ocampo, and I'm here to represent the Group 6. So I'm going to discuss the impact of COVID-19 and elderly in Indonesia and the Philippines. So first, the condition of the elderly, mostly in Indonesia, are not living with their relatives. Instead, they are staying in nursing homes. So in the presentation of the Indonesia UMY University earlier, they mentioned that 5% of the respondents stated that they have never communicated with their relatives, friends, and neighbors. And 75 respondents stated that they keep social relations with their relatives via telephone. So here in the Philippines, most of the elderly here are staying with their families. And at least percent is staying at nursing homes. So when it comes to the similarities, when it comes to vaccination, um, the senior citizens in Indonesia and Philippines, vaccination among senior citizens is prioritized by the government. So my group mate in Indonesia mentioned that a big percent of the elderly people there are not yet fully vaccinated because of their anxiety they're feeling due to the rumors of death. While here in the Philippines, as of September 22, there are 4,316,470 are fully vaccinated. So when it comes to the benefits, so in Indonesia they have different programs such as PKH or Program Keluarga Harapan Family Hope, where there is assistance for the elderly people during this pandemic. While here in the Philippines, we have different benefits that the government is giving, like PhilHealth insurance, financial assistance or ayuda, and social pension, senior citizen discounts, free medications, and checkups. So this is to ensure that the elderly people is receiving a good care. So that's all. Thank you.
Okay, thank you. From room 6, do you have any opinion or question for room 6? Any question? Okay, if not, Sensei?
Yes.
Yeah, okay, Sensei, please.
Thank you. I couldn't get the presentation. So Philippines gives incentives to the health elderly people, like a few health, 20% of discount of, yeah. So how about Indonesia? Do you have any incentives to the elderly people?
Okay, do you have any incentive? Oh, Sensei, I think I will ask the question because this is the question is quite difficult to my student. Okay. Okay. In Indonesia, we have the elderly in Indonesia. That's very variative. Do you know variative? The elderly in Indonesia who have pension if they were civil servant before. I mean they before when they were young, they work in the government or in the company. They have the pension. But if the elderly people, farmer, merchant, and not work in the government, they don't have the pension. So they will have the problem in economic. They will have the economic problem when they to be the elderly people. So this is why it's one of the problem in Indonesia, especially for elderly people. Okay. Enough, Sensei? Okay, thank you. Okay, so we will move to the room 7. Okay, please.
Yes, I will discuss about the differences and the similarities of Japan, Philippines, and Indonesia with regards to the situation of our elderly people. So first, in Japan, mostly the elderly people live alone. They live alone. So they do not have immediate family or relative with them. Unlike in Indonesia and Philippines, they live together with their families and relatives, which is why it is easy for the family members to look after their parents or their grandparents. Unlike in Japan, only few look after them. So also, what's good about system in Indonesia and Japan is that they have this home visit by the healthcare workers. So from time to time, they are being visited to check up the on the health of the elderly people. Unlike here in the Philippines, the elderly people still have to go to the health center just to be checked up. So there is just rare cases of home visits. Just for example, if you have any private doctor or family doctor, that's the only time that home visit will be done. And then since we all know that there is decline in social activity and physical activity of among older people, Japan and Indonesia still have this organizations or communities that cater the needs of the elderly people. So they still meet together and they just following the health protocols. While here in the Philippines, they meet but among the neighborhood only, because since there is restriction on social distancing, so it is limited for the elderly people to meet each other. So for for the consultation for the medication here in the Philippines and Indonesia, it is free, while in Japan they still have to pay. So that's it. Thank you.
Okay, thank you for the summary. And do you have any question for group room 7? Any question for room 7? No one raised hand. Okay, thank you for the presentation, and we can move to the last room 8. Room 8, the time is yours.
Hello, good morning. So I'm Trisha, and for our group, we discussed about the condition of elderly people. So in both Indonesia and Philippines, most of the elderly are living together with their families. But sometimes for elderly who don't have families to take care of them, the government provides a home for the agent where their health and safety is monitored. And while in Japan, it is more common for the elderly to live in the community with other elderly people and have nurses to take care of them. Also, in all the three countries, government provides health insurances for all elderly people, especially during this pandemic. We'll also discuss that in Indonesia, Philippines, and Japan, elderly people are in priority group for vaccinations. We also shared to our group mates that in the Philippines, people need to have medical clearance if having comorbidities for them to get vaccinated. Also, government give goods such as food, especially to those who are not financially stable families. That's it.
Enough from room 8. Okay, any question? Any question, or do you have any conclusion about this? Sensei, Dr. Jason, I think this is the last activity today. If you have any comment or suggestion for this today activity. Okay.
Yeah. Yeah, thank you very much. Thank you very much for your presentation about group work, and it's very interesting because you realize the situation of elderly is the same in Philippines and Indonesia, and Japan is different. Yeah, I think so, and I think in terms of the vaccination, our government cannot manage the dose, imported dose, so they started to prioritize the vaccination to the health workers and the elderly people at the same time. So it caused the confusion to the people because health workers cannot have a vaccination still, but already has elderly people got the vaccination, and that kind of things was happen. But Philippines and Indonesia, that system is very organized, and the priority of the vaccination was given to the health workers first, and then elderly people. So vaccination system is very systematic in Philippines and Indonesia. I realized that and very interested. Thank you very much.
Okay, thank you, Sensei. Dr. Jason, do you have any opinion?
There is much
I think that Dr. Jason have the problem with the audio. Okay. Okay. Yes, there's in the chat room. This is a very nice question. Yeah. Okay. In Japan, not enough caregivers in Japan. Okay. Okay, no problem, Dr. Jason. I will continue this room. So I have a conclusion for this meeting today that the population in Japan, in elderly people in Japan, in Indonesia, and the Philippines, this is a difference because depend on the quality of life. Yes, in Japan, the life expectancy for elderly people is quite high, I think, and so the elderly people in Japan, the percentage more high than the other country, and the vaccination is the most priority in elderly because the elderly is the people who have a high risk, and they were covered by the government. And almost of the elderly in Indonesia and the Philippines still stay with their family, but in Japan there is a nursing home and just a little elderly who stay with their family. Okay, and the insurance of the incentive is depend on the regulation of the government itself. Okay, I think this is my summary today, and thank you for the interesting presentation, and see you for the 27, right, Sensei? Or you have any information to the participant for the next agenda?
Yes. In the next time, we are going to summarize this program, and I will review the summary of your presentation. Then lectures of 3 universities, 3 countries present about nursing education, current situation of nursing education, and how we manage the remote education on nursing. Then I'm very interested in your activities, student activities under the COVID-19 pandemic for helping the people, because there are so many people are moving on the activities to help the people as health workers, student. Yeah, so that's the contents of next program. Okay, thank you.
Okay, yeah. Thank you, Sensei, for the information, and I hope that all the participants will prepare about the next activity. Okay, thank you very much for today, and thank you for your attention. I close this meeting today. Alhamdulillahirrahmanirrahim. Wassalamualaikum warahmatullahi wabarakatuh. See you next time. Thank you very much. Yeah.
Waalaikumsalam. Thank you, everyone.
Okay.
Maybe we can have
Thank you.
group pictures.
Yes,
oh,
please.
okay. Yes. Yes, please.
Yep. Okay. 3,
2, 1, smile.
Okay.
Another one. In 3, 2, 1, smile. Thank you.
Thank you very much.
Thank you very much.
Yeah. Thank you. See you. I leave the meeting.
Bye.
Yeah.
Thank you.